Welcome to another video. In this video, we will continue learning the respiratory system starting with pulmonary embolism. What is a pulmonary embolism? A life-threatening hypoxic condition caused by a collection of particulate matter such as solid gas or liquid that enters venous circulation and lodges in the pulmonary vessels, causing pulmonary blood flow obstruction. The contributing factors of a pulmonary embolism are the following: chronic atrial fibrillation, hypercoagulability, long bone fracture, long-term and mobility, oral contraceptives or estrogen therapy, obesity, postoperative, PVD, DVT, sickle cell anemia, central venous catheter. Now, let's imagine what a patient with this condition may present with. The signs and symptoms are dyspnea, tachypnea, sharp stabbing pain on inspiration, tachycardia, hypotension, sense of impending doom, diaphoresis, decreased SAW2, pleural effusion, crackles and cough. Note petechiae of the chest and armpit are present only with fat emboli. Now, with all diseases, diagnostic procedures are a must-know. Nurses specialize in patient care, prepare patients for testing and evaluate health progress. Diagnostic testing refers to any test that may provide a diagnosis for a condition, disease, or syndrome. Diagnostic procedures for pulmonary embolism include the following: ABGs, D-dimer, chest X-ray, VQ scan, pulmonary angiography. Important nursing actions include the following: assess respiratory status and vital signs, provide respiratory support, provide oxygen therapy, position in high Fowlers, initiate IV access, provide emotional support. The two main medications for this condition to know are thrombolytics and anticoagulants. A patient may need the following therapeutic measures, which are embolectomy and vena cava filter. Client education. It's important to teach the client preventive measures, dietary precautions with vitamin K due to coagulation, follow-up for PT or INR, bleeding precautions, and home oxygen therapy. Now, in this part of the lesson, we will learn about pneumothorax, tension pneumothorax, and hemothorax. It's useful to know what the major differences are, starting with pneumothorax. Pneumothorax is a collection of air or gas in the chest or pleural space that causes part or all of the lung to collapse due to a loss of negative pressure. Tension pneumothorax occurs when air enters the pleural space during inspiration through a one-way valve that is not able to exit upon expiration. The trapped air causes pressure on the heart and the lungs. As a result, the increase in pressure compresses blood vessels and limits venous return, leading to a decrease in cardiac output. Death can result if not treated immediately. And hemothorax is an accumulation of blood in the pleural cavity. Contributing factors of these conditions are the following: blunt chest trauma, COPD, close occluded chest tube, advanced age, and penetrating chest wounds. Signs and symptoms include the following: respiratory distress, tracheal deviation to unaffected side, reduced or absent breath sound on the affected side, asymmetrical chest wall movement, hyperresonance on percussion due to track air, subcutaneous emphysema, and chest pain. Diagnostic procedures include the following: chest X-ray, thoracentesis with hemothorax. Important nursing actions include the following: monitor respiratory status, administer oxygen, position in high Fowlers, monitor chest tube and dressing, and provide emotional support. In order to help the patient improve immediately, there will be a need for use of a chest tube insertion. A chest tube is inserted in the pleural space for draining fluid, blood, or air. This reestablishes negative pressure, which facilitates lung expansion. Nursing actions to know are the following: position supine or semi-Fowlers. Verify informed consent is signed. Prepare chest drainage system prior to insertion. Administer pain and sedation medication as prescribed. Assist provider as needed during insertion. Maintain chest tube system. Monitor respiratory status. Well, that's it for this video. In the next video, we will continue the lesson by learning about chest complications and airway management. Thanks for watching. If you found this video useful, please like and comment.